I'm hoping that in the next 10 minutes or so, I'll be able to explain to you how conversation has the power to improve not only health, but also education, gender, and general development within our community as well. Now, I'm going to go back to the first time I was actually introduced to this concept, which was a few years ago now when I was still a student studying my master's. I was in one of my classes, and the professor I had at the time explained a research project that he was part of. The research project was looking at trying to reduce neonatal mortality, which basically means the number of children dying during the first year of birth in Nepal, who at the time, in 2010, had a significant burden of this particular issue. Nepal was an underdeveloped country with very limited funds, and they had issues in trying to find ways to tackle this very, very big problem. Why is it a problem? Because in public health, if you find that children are dying early in their lives, it tends to mean that your mothers are not very healthy, which means your society isn't very healthy. So, from a public health standpoint, this is a really big issue. What these researchers did is they thought outside the box, and they thought very simply. They didn't build a hospital. They didn't go and ask for training or for vaccinations. What they did is they invited women in rural cities to sit and have conversations. Simply, they were told to talk about what it is to become a mother and to become pregnant. Now, interestingly, what this allowed was, for the first time for many of these women in these rural areas, they hadn't been given much opportunity to discuss or talk about something that is quite taboo still in that society. This gave them an opportunity to actually engage in conversation, ask questions, and learn from each other's experiences. So, the collective knowledge of these women was elevated because of this particular initiative. Simultaneously, because the collective knowledge was elevated, these women were now informed about where the problems were and how they can improve them. So they were actually empowered to actually find solutions for themselves. Now, this research project didn't just help on a social level. Statistically, it actually led to a really significant reduction in neonatal mortality very, very quickly after the initiative was actually implemented. So you see, conversation can be very, very effective, very cheap, and incredibly useful when it comes to reducing issues in the health sector. Now, as a student hearing this, I was triggered into this sort of passion about how conversation and communication can lead to better health outcomes. I actually pursued this knowledge throughout my career. Knowing my career as an educator, one of the key skills that I use is, in fact, instigating conversation. That is what being a teacher is. Excuse me. Classically, the conversation would have been one-sided, much like I'm doing right now, ironically. But I'm sure that if I asked you which one was your favorite teacher, which one was your favorite class, it would be the one where you were given the opportunity to communicate with your instructor, to be able to engage in conversation. One really great example of how conversation, a two-way conversation, is incredibly useful and empowering is actually one that is very local to us. I want to refer to the case of female genital mutilation. If you don't know, female genital mutilation refers to the cutting or mutilation of female genitalia, and it's sometimes called circumcision, but unlike male circumcision, it has no health benefits whatsoever. It actually leads to a lifelong suffering for women who are cut. In the early 2000s, we found that we had a burden of FGM within Kurdistan region of about 40%. That means every 4 in 10 women had been cut. That in and of itself was incredibly shocking as a statistic. But what was more shocking was at the time, nobody knew about it. Not the government, not the communities. In some cases, not even members of the same family knew their daughters had been mutilated. It wasn't until a revolutionary documentary was broadcast that we actually were able to understand that we have this issue within our region. That documentary triggered conversation, not only among people who had been cut, but also among wider community members, religious leaders, and governments. And effectively, it actually led to the implementation of a new law that outlawed FGM. Thankfully, if my slide will move. No? Thankfully, this initiative, this conversation starter, led to a reduction in FGM within the region between 2011 and 2019 by over 40%, which to me is an incredible success. Now, speaking about FGM is really fun for me, not because of the topic itself, because it's quite a unfortunate topic, but it's fun to see my students' reactions when they realize just how big an issue it is in our region. Simultaneously, it's also really enjoyable to see them light up whenever I open the opportunity to talk about something like sexual health or mental health. I'm sure many of you are aware in our society, those particular areas are a little bit more difficult to talk about publicly. We still have a lot of stigma and shame surrounding them. But we do have a huge burden of issues regarding mental illness. WHO estimates that about 260 million people suffer from depression globally. Research in the region of Kurdistan during the COVID pandemic tells us that we have about 40%, I believe 45%, who identified as having depression, and 47% of our population having anxiety. Now, from my experience, I would argue those statistics are relatively conservative, and actually we have a much greater burden of mental illness because we've had generations of trauma and conflict and issues. Why am I mentioning this? Because what's really fascinating to me every time I instigate a conversation about mental health or mental illness is my students tell me they didn't know how common it was. They become a little bit more comfortable knowing that they are suffering from something that everybody else seems to be suffering from also. What this does is it allows not only sharing of information, but it empowers a person suffering from mental illness to actually seek help because they don't feel like it's just them. Simultaneously, it also empowers people around the people who are suffering to become better supporters. If I know what depression is, I will know how to help someone. If I know how to identify anxiety, I will be able to assist someone going through an attack. This is something that, in general, not only helps individuals, it helps communities become more cohesive and better in relation to health services and health provision. And therefore, it develops our health in general. I want to refer in the last part of my speech to another example, because I've mentioned how positive communication and conversation can be. However, there are some examples where conversation can be detrimental to health. I'm going to refer to something that I'm not sure you may have heard of, I don't know. It's something called COVID-19. Maybe you have heard of it somehow. During the pandemic, we were given the best example of how conversation and communication can sometimes be worse for health. This virus stopped governments in their tracks, and it made it very difficult for communities to be able to share good information because there was so much bad information being shared as well. The reason I mention this is because not only governments, but also individuals and institutions have a responsibility of making sure that when they start conversations, they speak from a place of science and fact, and not from a place of opinion. Because that is the only way that we can actually encourage better knowledge awareness and also better empowerment for decision making as well. I digress when I talk about this because actually I want to come back to my final point, which is the purpose of my talk here today. I've talked about how conversation has helped people in Nepal, and it's helped our government identify and solve issues regarding FGM, and talked about how conversation can be bad in the case of COVID. But what I want you to take away from this particular talk today, if anything at all, is that it is not the responsibility only of governments and institutions. We each have the ability to have a rippling effect. By simply having a conversation about menstruation, for example, a conversation about depression, a conversation about cancer awareness, you are effectively enabling those around you to engage in that conversation with you, and you are effectively having a positive impact on your society. This particular TED event has been aptly named Rise Up. For me, Rise Up refers to development of our systems, development of our societies, development of our health. And for me, what that means for us, in order to achieve rising up in terms of health, we must first speak up in terms of health. Thank you so much for your attention.